It has now been a year since the first COVID-19 vaccine was approved last December. Healthcare workers started receiving the vaccine. Now, children ages 5 and older are eligible. We've come a long way, but we are not done yet. So in today's 2-Year Wellbeing, we're going to talk about the vaccine, where we are now, steps going forward. Cone Health's Chief Pharmacy Officer, Dr. DeAnne Brooks, is joining us. All right, so first up on everyone's minds is the new variant. What can you tell us about this new variant?
So there's a lot that we don't know about the new variant. What we know that is that it was first seen in South Africa, and that is also an area within the world that has a very low vaccination rate. We do know that it is now in the United States, and it's in right now, I believe, 15 to 17 states. Right now, Delta is still our primary variant within the United States.
Right, and of course this, those numbers and all of that kind of stuff, that information is ever changing from minute to minute, it seems. Will the current vaccines as we know it now protect us from this new variant?
You know, we really don't know exactly yet. It is so new that we don't know exactly what the transmissibility of it is. Is it more infectious, for example, than Delta? We really don't have enough information yet to know that.
And of course, that will probably change. I mean, it could be this time next week that we have enough data to know what happens with our vaccines and what doesn't.
Exactly. And what we do know now is that we do have the tools to help us combat this pandemic. And those tools are our vaccines and also testing, as well as wearing masks. So we do have the tools still available to us to reduce COVID-19 within our communities.
Okay, and that data continues to change. All right, let's talk about the booster shots now. Now, who is eligible for a booster shot?
Everyone who is over 18 years old is eligible for a booster shot now. Pfizer has recently asked for authorization for 16-year-olds, but right now it's 18 years and above for everyone.
Right, and we're definitely going to have more questions about that, so that's okay. If you've got a question about a booster and Pfizer or kids or whatever, feel free to ask it. We're probably going to repeat some of the information over, and that is okay. We want to make sure everybody gets it. This next question is, what happens if someone is immunocompromised, like in your family that you may be seeing during the holidays? Should they get a booster shot? Should you get a booster shot?
Yeah, so if the individual is immunocompromised, they should get the booster dose for an immunocompromised recipient. And that's a little bit different for the Moderna vaccine. It's a different dose for an immunocompromised recipient versus a recipient who's not immunocompromised. And but they both should get it. So if you're traveling and you're going to see someone, an older grandparent, anyone who's immunocompromised, you should get your booster before you go see them.
And if you're the immunocompromised person, I'm guessing, we filled out so many forms as we all got our vaccinations and our booster. I don't know if I saw anything that said, are you immunocompromised, so that they would know when you went to go get that shot.
Yes, and we do have that question as well. Are you immunocompromised?
All right, so make sure that you look for that. All right, so how about the vaccination rate? What are the numbers currently?
Yeah, so the numbers currently in North Carolina are that we're still less than 60% fully vaccinated. We are getting a little bit above 60% when you look at 5-year-old plus. So for people that are actually eligible for the vaccine right now, 62% have received at least the first dose, and 58% are fully vaccinated.
All right, how do you think that figures in as we're heading into the holidays, getting together with people, colder weather, and this new variant?
It needs to be higher for sure. And we have seen an uptick in this last week of people who have been getting their vaccines, and we have increased our vaccine capacity at Cone Health. And so I encourage everyone, if you have not been vaccinated, or if you have, it's been 6 months after your Moderna or Pfizer and you haven't had a booster, go ahead and get your booster. If it's been 2 months after your Johnson & Johnson vaccine, it's time to get a booster.
Right, and so ages 5 and up are eligible for the vaccine. It used to be that the group that had the lowest vaccination rate was the younger kids. Is that still holding true?
You know, actually, we really need to boost our vaccination rate in our 18 to 49-year-old population, really that 24 to 49-year-old population. We don't have enough of that part of our community within North Carolina getting the vaccine. And these are also the folks who typically are out and about the most. And so I really encourage everyone in that age group, as well as everyone, if you have not received your vaccine, please go get it. And if it's time for your booster, go get your booster.
Okay, and the big swath of that age group is the 18 to 49, but you said concentrated 24 to 49?
Yeah, there's different ways that you can look at those numbers between our internal data as well as what's on the NCDHHS website. And so we specifically concentrate on that 24 to 49-year-old. But when you look at the vaccine dashboard for the state, that entire age group, it would really be helpful to get everyone vaccinated.
All right, well, let's talk about that age group, especially since they're the ones that are out and about more often. What are some of maybe the vaccine myths or concerns of that age group that maybe we should address?
Yeah, a lot of it is really, hey, I'm young. If I get this virus, I'm not likely to be hospitalized or have serious illness. And what we've seen when we compare last year's data to this year's data is that more younger people are actually being hospitalized, and there have been more deaths from COVID-19 in that age group than there were compared to last year. And also there are more people in those higher age groups who are vaccinated. And so that's why those numbers are changing. And the other thing that I think that age group thinks too is that, well, I've probably already had COVID-19, even though I never got tested for it. And so I should be okay. And even if you have tested positive for COVID-19 and have had the illness, we do recommend that you get vaccinated for full immunity.